Okay. All right. Thank you all for coming. This is our second conference, as you know, and one of the reasons why we're here today is to talk to you about updates. We have now approximately 200 patients from HealthPlus who have walked in our doors, each with their own unique story to tell about their experience. And a number of them had more than one experience. Some were there 2, 3, 4 times. We also are going to speak to today a medical director of a facility right here in Bergen County who operates the New Century Ambulatory Surgery Center in Paramus. And I asked him to come here today to address what is the state of the art, how do you prevent what happened in this case by following appropriate standards of care. We also have one of my staff who has conducted many of the interviews of our Spanish clients to share with you in Spanish what she has learned from these people. 2 of my clients have proved positive, one for hepatitis B and one for hepatitis A, which is not on the list, but we will discuss how that comes about and how it could have come about in this case. So there it is. I want to give you some demographics. Where do these people come from? We have found that at least 50% are from New York, from Brooklyn, Bronx, Astoria, Corona, some from out in Nassau and Jamaica. So all the boroughs are covered, even a few from Staten Island. So that was a surprise that so many were coming in from New York. At least 50% are Spanish speakers, as I've said to you. Those are the demographics. We do have clients who have signed up from Newark, Patterson, Jersey City, a few from Bergen County, and from, I think, as far off as Somerset County, a few. So there they are. I want to tell you that all of these people are suffering shame, embarrassment, humiliation, given the news they received over the holidays. One who you will hear from, Irelka, who's going to talk to you in Spanish, shared with us that when she received the news, she broke it to her husband, and he said to her, "I have to leave." And he left for Pennsylvania to stay with his family, stating that if I get sick, who will provide for us? So we have to stay separate, we have to stay apart until we see where this goes. One of the unfortunate things that I'm finding are people are calling me and saying, my first blood report showed negative. I'm good, I'm fine, I won't be following up. And I have encouraged those, my staff have encouraged those, look, we can't give you medical advice, but you may want to consult with your own doctor about whether you're good or whether you need follow-up. We all know, don't we, that the incubation period could be a year, could be more, that HIV may not show up for a decade. Hepatitis B may not show up for a decade. Hepatitis B may have no symptoms, but yet you're carrying it. So these are at times very subtle conditions, but can be very overwhelming and can be life-threatening, of course. So one of the things I would like to get out through this conference is medical education. For those of you who are listening, for those of you who have been exposed, talk to your own physician. Get your own medical counseling. I have learned that many people still have not received a letter from HealthPlus. They're getting phone calls. Some haven't not gotten phone calls, but they came saying, look, here's when I was there. I was there between January and September. And here's my report to prove it, but I haven't gotten a call and I haven't gotten a letter. So we've interviewed those people and we've encouraged them to get a full panel of blood tests for hepatitis B, C, and also HIV and also A. I would like to introduce to you Dr. Thomas Ragukonis. Dr. Ragukonis is a physician. He's board certified in pain management. He is the medical director of New Century in Paramus. And one of the things I asked him to address is what should a patient, what should a medical consumer be asking for? Should be talking to his or her doctor about, and should be consulting with the ambulatory center that they need to know. He's also going to talk about what are the protocols for a safe center. Dr. Ragukonis.
So thank you all for coming.
Doctor, do you mind spelling your first and last name for us?
Sure, Thomas, Thomas, Ragukonis, Ragukonis. Thanks everyone for coming. So one of the things that I'd like to educate the potential patients of any surgical center is to ask questions. And there are a few questions that are very important for an informed medical consumer to ask of their doctor. The patient obviously goes to the physician first. A procedure is suggested, prescribed, and then the doctor informs the patient of essentially where the procedure will be done. It's important to know from a consumer standpoint that the patient has options. It's not a dictatorial state, so that the patient needs to be informed. That sounds very simple, but it's very integral. As soon as the patient gets the name of the institution, the patient has to ask a very simple question: why there? And the doctor should be ready to give a whole litany of why his practice or why that patient is going there. And it has to be congruent with the best interests of the patient. Once the patient gets the answer to that, and obviously the patient has the name of the institution, I would encourage the patients in the world of the internet. Most institutions have websites. Take the time. This is your health that we're talking about. Go on the internet. Go to the website. Get very simple questions answered. Who owns the center? Who's the medical director of the center? Who is the nurse manager of the center? Who is the infectious control officer or designate of the center? How long has the center been in operation? It's also a little bit more tedious to go to a state regulatory website, Department of Health. Has this center ever been closed before? Have there been any problems with this center? That's a little more involved. Bottom line with regards to the website is if your questions aren't answered, or if there's a feeling that your questions aren't being answered in their entirety, you need to go back to the physician and query him as to what the questions are and what your concerns are. Today, infection control in the day of superbugs and very virulent viruses is paramount in any healthcare setting. By and large, most statistics will say that patients are actually a bit safer from infection in an outpatient setting. By and large, sicker people with more virulent infections are institutionalized in hospitals. That's generally not the case in ambulatory setting. So it's generally advantageous to, if you're healthy and you're having an outpatient procedure, to have it in a less infectious environment. Having said that, as a consumer, as a patient, we assume that all the proper infection control issues are being addressed, and we really have to, as consumers, verify that before we lend our bodies to a procedure. What else, Michael?
Well, what I'd like you to share with everyone is that you have a center. What do you do to assure that your patients, when they come in the door, are safe?
There are a lot of very stringent regulations set forward by the state. And obviously, to be certified by the state, you have to pass that inspection. The problem with inspections is it's a picture, not a movie. So it's a snapshot in time. So the state regulatory institution, Department of Health, will come in, or Medicare will come in, they'll inspect you on a certain day. It's up to the institution itself to maintain those minimum standards. By the way, those are minimum standards. I'm an advocate for much higher standards than just the minimum set forward by the state. As a medical director of a center for over 20 years, it's imperative that you have a nurse manager that's certified and has experience in running a center, that's familiar with all the infectious regulations. You need to have, we need to have, as a surgical center, a designated infectious disease officer who's certified. There are certifications for this, and we have an appointed nurse, a special nurse, above and beyond the director who's certified, a special nurse that just deals with infection control. We have to monitor infection control. As the medical director, I sign off, I think, every 2 weeks, if not every month, on any reported infections or exposure to infections in my center. That's just the way it has to be. Above and beyond the normal Medicare inspections, Department of Health inspections, there are other agencies, such as the AAHC, that come in. You have to invite them in, and they do a voluntary inspection. And they're another critique organization to say, hey, this is what you're not doing quite as well. You could improve here. And these institutions should be invited in frequently. And then it's just educating your staff that cleans the instruments. They need to be certified as well. And just good vigilance and vigilance and vigilance.
Tell me, at your center, what have you done to make sure that your patients are receiving an assurance through what you have implemented at your center that they will not suffer what we have learned recently?
Well, we try to educate our patients as much as possible. We have a very nice website. We have in my practice as well as for the center. I think education is very powerful, and then they can make the decision. But insofar as in infection and infection safety, again, these government regulatory agencies place a minimum for safety. I think it's beholden on the surgical center to go above and beyond the minimum. At the risk of sounding like a commercial, at New Century, we have ultraviolet lights in our facility. We're the first facility in the United States, actually, to have ultraviolet lights. Ultraviolet lights kill bacteria. So when we leave at night, we close the lights. The lights literally turn purple, and they're on for 8 hours. And they basically wipe out any kind of infection in the entire rooms. There are certain coatings, which we have, floor coatings, that are embedded with antimicrobial and antibacterial chemicals, non-toxic to humans, obviously, So if anyone drops anything there, obviously appropriate cleanup is involved, but the microorganisms, if any left, and can be likely, are killed by the embedded chemicals in the floor. All the surfaces that we touch, for example, such as door handles, any metallic handles in our institution, are covered with a antimicrobial covering, which is basically based on silver. Bacteria cannot live on silver. So these are some of the things, seamless floors, for example. These are some of the things that may not necessarily be necessary to have as far as the state governing organizations, but I feel are important because we have to go a step above and beyond. There's a saying in medicine, and I'm not a Latin, but it basically says "prima non nocere," which translates to the first, do no harm. The patients are there to get better, so the responsibility is first, do no harm.
Thank you, doctor. Did anyone have any questions of the doctor? Any at all? I was going to ask Irelka, who has been working with these people day and night for the past couple of weeks, to share with you, and she's happy to speak in Spanish and share some of the stories. If you could just give some of the highlights, you don't have to identify anyone, but just give some of the highlights of what you've experienced.
Good afternoon. He estado trabajando con el abogado Maggiano, traduciendo para este caso hace 2 o 3 semanas. Es muy triste ver todos estos casos de familia hispana que han estado trastornados, avergonzados y muy triste por lo que está pasando. Por ejemplo, la situación de una señora que el esposo la dejó porque tiene miedo a ser afectado. Tenemos casos que han resultado positivos con hepatitis B, con familia con niños que pueden ser arriesgados a este problema. Me entristece ver toda mi familia hispana que no sabe que puedes recibir un tratamiento mejor como persona y llega a estos lugares y cree que le están dando atención correcta y no es así. Quiero darle de consejo que por favor primeramente si fueron a este lugar y todavía no los conocemos, hágase un examen con su doctor. Chequee que usted está bien de salud y que por favor repita esos exámenes cada 3 meses. Y para todos allá, que cuando quieran ir a ver a un doctor o tengan un accidente, que por favor chequeen en el correo, que chequeen información acerca de su doctor a quien va a ver, para que tenga todos los documentos correctos para saber que es un buen doctor para usted. Oyendo todas estas historias me entristece mucho, mucho, porque veo mucha gente hispana que no cree que se merece mejor atención. Y realmente sí. Y estoy aquí para ayudarlos. Si necesitan llamar a la oficina y necesitan alguna pregunta, aquí estamos para ayudarlos. Gracias. Iralka, Yralka. Maggiano, Maggiano. Thank you. Sure. All I'm saying is I've been helping Michael for the past 2 or 3 weeks translating with these people in Spanish, and it really hurts me because these are my family. These are people that I could relate to, that they go to these places thinking that they're getting better attention when they're not. And a lot of them are hurt, they're in pain, they're embarrassed with their relatives, they don't want to say anything because a lot of families are very ignorant towards these diseases and they don't know how to act to it. So it's very sad to see all these cases. A lot of people, because of their ignorance, leaving their wives, moving to places, kids are around these families. It's very sad to see them, how they're taking this. And that's why I'm here with Michael, trying to help them out with all these families and trying to make them feel better and more at peace. Because right now, they have a cloud over their heads. They don't know what's going on. They're afraid of going to work. They're afraid of being around their family. I have a mother telling me I don't want my son to kiss me because I'm so afraid. So it's a lot of people that are affected by this. And it hurts me personally because I'm a Spanish native and I see some of these people don't know any better. So it's very sad. And I just want to tell them, you have to do research like the doctor says. See who you're going to see. There's so much better out there for you. Just look out and search for the best. Thank you.
Thank you.
Well, you could sense the passion, and this is what the people have felt that they needed and they weren't getting, and that's compassion and passion. They have been put through a system, and they are human beings, and they are patients. And as the doctor said, the first rule is do no harm. One thing that I have noticed is that the reactions are real, but they demonstrate why we're bringing this case. There are colleagues of mine who said, Mike, if they test negative, where's the issue? Where's the harm? The harm is that they were exposed. The harm is they won't have answers for perhaps a year, at least, perhaps a decade, at worst, or more. Or in their own minds, what happens when I have to go get my blood test? They're in fear of even getting a second blood test. I'll live with the first, I'm good, it's okay, I don't want to get blood tested again. You must get blood tested again. So there is this post-trauma disorder that is manifested with these people. They're hypervigilant. They're conducting themselves in ways that you don't have to. I mean, look, certainly you have to exercise prudence and protection in relations. You have to be vigilant with regard to cutting yourself or and exposing that blood to other members of your family or the passing of bodily fluids. But beyond that, people are wiping everything down in their houses time and time and time and time again with alcohol, with Clorox, you name it. The hypervigilance is off the charts, and that's their day, and they're in this cycle. And so I have encouraged them, talk to your priest, talk to your rabbi, talk to that religious person in your life that you share problems with. Speak to a therapist, see a social worker, consult your primary care physician, but talk to somebody. I know you don't want to talk to family. I know you don't want the word to get out, and you've asked me to promise not to mention your name at the press conferences. But get help, because you must be prepared to go the distance for your sake and your family's sake with regard to these conditions. So that's what they're dealing with. Our Supreme Court in 1997 decided a case that said for the exposure to HIV, and thus the exposure to hepatitis B and so forth, a claim is merited. It is foreseeable that people will react adversely, as these folks have. It's foreseeable, it's a foreseeable consequence of such exposure, and when documented, it is compensable. So I have told all of these families, whether you're identified as carrying B, C, or HIV or not, you have suffered. And also we have to make a claim for medical monitoring. It costs money to go to doctors. It costs money to have tests done periodically. And this will go on not only for a year, but in some cases with those who have been diagnosed and those who have not, for perhaps a decade, to do it right and to make sure you're out of the woods. So there it is. That's where we are. As you know, I filed the complaint on December 28th. I'm waiting on an answer. Service has been properly made on HealthPlus, and the litigation is about to move forward. Thank you for being here. Say that again, Lindy?
When will the class be
Well, that will probably take place after an answer is filed, and we've identified defense counsel, and I believe I will be getting a call from case management, and as will other lawyers involved, and there'll be a discussion on that. There'll also be a discussion on venue. As you know, an action was filed in the Eastern District Federal Court. An action was filed in Essex. And so there'll be a discussion on how does the system deal with separate actions elsewhere or not. Now let me share one point with you about certification. Some have said to me, well, isn't this a mass tort? A mass tort is when you have a mass disaster and people are injured, but injured in different ways, right? For example, if it's a construction disaster, some might lose their lives, some may lose limbs, as in the Tropicana garage case that I was involved in a number of years ago, where we had 40 people. I was lead counsel with two other attorneys, and we handled that as a mass tort. Everyone had a uniquely different injury and different impact, but we handled it under one case, and we handled it, as you know, in Atlantic County. In this case, it's a little different. This did not happen at one time. It was not one event. Everyone suffered at different times in different ways over at least a period of 9 months. So these are 3,700, perhaps 4,000 events. And each one who is there more than once has the potential exposure more than one time. So this is very different than your typical mass tort, and it's very different than your typical class action, where we're used to suing for one thing that we all suffered from by a company or what have you. This is an interesting case. I believe it will go the class action route because of its nature. I believe it should get certified. It's the only practical way of handling the case. I believe that there will be a steering committee, and I believe there must be a chairman of the steering committee on behalf of plaintiffs and plaintiffs' counsel. That's the logical way of doing this, and that's the judicially practical way of handling it. But look, I don't call it. I'm a practitioner. That is my best guess as a regular practitioner at the courthouse. Any other questions?
You mentioned you've talked with 200 patients. They're all you categorize them as clients.
They are.
Okay, and then 2 of them have tested positive. Can you elaborate on that? And one of the positives was hepatitis A, which is not named by HealthPlus, if I'm not mistaken. Right? They had said HIV, Hep B, and Hep
Yes.
C. So can you talk about why the hepatitis case the hepatitis A case would be?
I think Dr. Ragukonis could address that better than I can.
Sure.
Doctor, if you would. That's really an important question. I don't think the class should be limited to BC and HIV, and I think the doctor's going to tell us why.
Yeah, there are. It really shouldn't be limited to just a few viruses, because the fact of the matter is, if the sterility was compromised and there were exposures to any bloodborne pathogens, that encompasses a whole kingdom, if you will, of microorganisms, bacteria included. With regards to the specific question about hepatitis A, hepatitis A is obviously a hepatitis virus, but it's a little bit unique and a little bit different from hepatitis B and C, in that hepatitis A can be transformed very easily through food products. It's well documented. You can get it eating bad sushi, basically. So it's highly transmissible.
But in a hospital setting, unclean hands, leaving the bathroom,
any
not
number,
putting on your gloves,
all of those, any number of ways that you can imagine. Any number of ways that you can imagine. And it's very easily transmitted. It should not be excluded.
If a person tests positive, like they have on this blood test, what does that mean? Do they have hepatitis B? They've been exposed and they can be treated to forestall it from developing?
Well, I can't represent myself as an infectious disease expert. All right, certainly as not a expert in hepatitis. But it's important to understand that every human being has different immunological response. Some responses are stronger than others, so that will determine the latency period, the response, and it's going to depend. And that's why Mr. Maggiano is emphasizing so much that these patients really need to see their own doctor and have an expert who knows their health history dive into this and see what's going on personally.
They said that the incubation period may not show up for a decade. That's what he said about if you're exposed. So what's the difference with all these people between exposure versus actually carrying it? Like, we're saying that there's a chance, or?
Well, there is a chance, but again, I'm not a virologist, and I'm not an infectious disease expert. That's actually sounds like a very simple question. It's an excellent question, but it's a very difficult question for a non-infectious disease doctor to answer, because the incubation period of hepatitis is very variable, and as we progress in medicine, there's a whole host of other hepatitis subtypes that are being identified. So it's a very good question. It sounds like a simple question, but it's very involved.
So potentially you're saying though that he's saying that people who were exposed could potentially find out that they've got this hepatitis in 8 years.
Again, I don't know. I'm trying to dodge the question because I really don't know the exact time frame of that hepatitis.
Okay.
Because I'm not like I said, I'm not an ID doctor, a board certified ID doctor. But there are certainly variable. I don't want you to pin me down to the time. Is what
Yeah.
I'm saying.
No, that's fine.
But bottom line on that point is, how closely related to your advice that they seek help from their doctor is it to the fact that this could incubate for quite some time?
Oh, I think it's paramount. It's paramount. They have to get there as soon as possible, because the patient's individual medications that they're on can affect their immunological response as well, particularly patients with longstanding arthritis, patients that are on certain medications, diabetics. It's very complicated. So that's why their individual physician that knows them best, knows their ailments, knows their medicine, really needs to address these problems.
Okay. If there's no other questions, I thank you all for coming today. Thank you.